Good evening and welcome to the Ombudsman program. My name is Diane Welborn and I am the Ombudsman for Montgomery County, City of Dayton, and the Dayton Public School Board. Welcome to the program this evening. I'm very pleased to have with me Jim Gross, who is with Public Health, Dayton and Montgomery County. And he is the director there, and he's going to talk to us about the wide range of services that are provided by his vital department. Welcome, Jim. Thank you for coming on the program.
My pleasure, Diane. It's great to be back.
Thank you. Glad to have you. Well, the term public health can almost encompass everything. And so please tell our viewers, from where does your department take their mandate? How do you figure out, among all of the issues related to public health, where are your specific services? Give us an overview.
Well, it's a really good question. And if we take a step back in time, let me try to frame the whole entire situation.
Please.
Actually, public health has been around for centuries and centuries. And it was well known, even a long time ago, that if you didn't have clean water, or if you had sewage where it shouldn't be, that could result then in the transmission of certain things that a body really doesn't want, and people get sick. And over time, there were many epidemics that actually took the lives of many, many people. And that's really how public health was really born, was that there was a need for communities to take care of these issues that were really shortening people's lives. And we're still doing that today, okay? We're doing some things differently, but we're still doing that today. And one of the big success stories of public health has been vaccinations. So when you have all of these diseases that were killing people over the years, when you were able to come up with a vaccine that provided protection from those diseases that were killing people, then you had public health in the making, and people's lives were not only being prolonged, but the quality of life was also improved at the same time. So what we have today is, for the most part, we do not have people dying from those communicable diseases. They're dying from something different. They're dying from chronic diseases. So as the health of the nation and the world is changing, public health needs to change with it. So what we are doing at Public Health Dayton Montgomery County is really providing services in three main areas. One is that traditional public health, dealing with communicable diseases. So things such as food service inspections to make sure that our food is safe. And we still get involved with communicable diseases. You know, there is still influenza, there's sexually transmitted diseases, there's tuberculosis. So we still do that. But we also get involved with chronic diseases. And I can get into the leading causes of death in Montgomery County and how those are really caused by what we do on a daily basis. We do it to ourselves. And then the third thing that we really work on, and Diane, I know you do this as well, and that is we try to help our population get access to health care. You know, we still have approximately 75,000 people in Montgomery County that do not have a regular source of health care. And it's hard to get healthy as a community when you don't have that.
Right, exactly. Well, we're going to touch on all of those things tonight as much as our short hour will permit, because there's a lot of protection going on. I'd like to start, if we could, with the immunizations that you mentioned kind of first after the clean water, and we'll come back to some of your monitoring in that area. It seems to me that there is almost always a new disease for which we are developing vaccines, which is a wonderful thing. But it's a lot, I'm sure, to keep up with. So then also there's always concern about the vaccination of young children. Right. Each year people come to my office who are just struggling with shot records to submit to schools and you know, to get all that kind of stuff taken care of. So I know that the immunization program really serves all range of the population, and even when we want to go out of the country and travel somewhere where they have diseases that we fortunately have eradicated for the most part here, we come to the immunization clinic to get our shots for those things. So talk a little bit about that wide range of vaccination programs and and what's available for our citizens now?
Well, first of all, our communicable disease clinic is extremely busy, and it's located in the Rival building, so it's right in the middle of downtown. And you're right, it really serves a lot of different people. You know, it serves infants, you know, all the way through our older population, and as you mentioned, those going overseas. And we see those individuals pretty much on a daily basis. So, you know, when there are a series of shots, for example, that children need to have, you know, as very, very, you know, tiny infants. And sometimes we are the clinic, you know, for people, and we do that. And there's a lot of different, you know, immunizations that those children need. And then, as you mentioned, you know, school-age children need immunizations to actually, you know, to get into school. And sometimes when those children are unable to get those vaccines, you can imagine how busy we are when schools open.
Right.
Because there comes a point in time when the schools say, you know, if the child's not immunized, I'm sorry, but he or she cannot come to school.
And they have to do that.
So they come right down to our office, and there are times where we have to pull out the chairs, and we have chairs lined up in the corridor because we are truly that busy. And then there's a whole different set of vaccine for teenagers, for example. And in fact, now you have to have, you know, certain shots to be allowed to enter into the 7th grade, okay? And you will hear often something called the Tdap shot, okay, which is diphtheria, you know, tetanus, and pertussis, you know, all wrapped into one. And then let's not forget the adults, okay? And with the adults, you know, they need to also have Tdap if they didn't have that, you know, when they were younger, especially if they're going to be around children, because we want them to have that protection for pertussis or whooping cough, you know, because if they're going to be around children, then they could be passing that on to the children. And let's face it, parents and grandparents, that's the last thing they want to do is to make the child sick. Shingles is another vaccine that a lot of our older population come in to get, and let's not forget the flu vaccine, because it is truly, you know, the most prevalent vaccine that we give to people across all ages. And, you know, we constantly urge our citizens to be immunized, you know, with regard to influenza. It's critically important. Every year it's important, and we have had problems in the past. You may remember in 2009, we had the H1N1 or the swine flu that was problematic, where we actually went into schools and gave immunizations in school buildings. And then we held very large clinics at Hare Arena and UD Arena and an abandoned really cinema down in the Centerville area as well. So yeah, we were very, very active. In fact, in 2009, we immunized 112,000 people here in Montgomery County, and I think that was the most anyone did across the state. And it was because we took the vaccine to the people instead of sitting back and having them come back to us. In addition to that, you mentioned the overseas. You know, people, when they go overseas, they come to us to get those special vaccines. So it's very, very busy. And it seems like, you know, no matter what we do, there's always something that comes up. Just this past summer, we had an issue with tuberculosis at a nail spa down, you know, just south of the Dayton Mall area. So we actually held special tuberculosis vaccine clinics as well this past summer. So it seems like, even though we think we have a handle on everything, stuff does happen, and we're the ones who usually get to respond.
And some other disease will pop up like that. So,
and you know, people no longer really die, at least in masses, you know, from these sorts of diseases anymore. But it makes people very, very sick, and we do lose some life. I mean, I don't want to make light of that. And in fact, this year, I think we're somewhere around about 6 different individuals have sadly lost their lives due to influenza just this year. Now, the good news is that we're keeping our fingers crossed, but we may have already peaked. You know, we're in the 2nd week of February right now, and I think that we've peaked, and let's hope that we continue to slide with regard to influenza. But sometimes you do get multiple peaks, but let's hope that we're on the downslide. And it looks like, at least in our region, that the flu perhaps has already peaked, and we're beginning to go down.
Well, that's a good thing. As I drive around town, I see whooping cough vaccines advertised on various marquees in different places. Is that particular illness or some others ones that that you would really advise our viewers that if they haven't checked or if they haven't had any kind of update, that are there certain diseases that we're seeing some problems with here?
You know, pertussis is one, and you know, sometimes it doesn't take, you know, very many, you know, cases to get things started. You know, because sometimes people are really they're living in close quarters. You know, you could have a child care center where things really start to get out of hand, or even, you know, a nursing home, you know, as well, where we have to go in and really lend a hand. But at the same time, I do want to say that we have a lot of people now in the community giving immunizations. You know, I can remember when we would have to order, you know, 25, 30,000 doses of influenza vaccine, you know, for us to give at the Ribble building, and now we don't need that much because we have all the big box stores giving flu vaccine as well.
Okay, so you're spreading that around. I'm being told that we have a caller on the line that has a question, so I'd like to stop you for a second and we'll take the call. You're on the air.
Hello?
Yes, I can hear you now. Please give us your question.
Thank you. This is such a wonderful program. So many areas that are important where I would like to ask questions. I'll just name a few. Your guest mentioned the flu vaccine, and I guess I'm concerned to know how safe is the flu vaccine. And my second question has to do with tuberculosis. I know there have been cases of tuberculosis in the Miami Valley, and I'm just concerned about where do those come from? What's the source of tuberculosis infection? Thank you so much, and I'll take my answer off of the phone.
Thank you. Thank you for that great question. Well, I'm sure you heard the safety of vaccines, and where does TB come from?
Well, the safety of the flu vaccine comes up every year, and I think most people consider a lot of what you hear to be myths. And I think, let's just take one, for example, and that is, you know, when you get the flu vaccine, you get the flu. And that's not the case. But when you take a look at when you get the vaccine, for example, it does not really go into full effect for about 2 weeks. So if you were exposed and actually contracted the flu in that 2-week period, then you can still get the flu. And indeed, that just by chance, I mean, that's going to happen. And the flu vaccine is not 100% effective, okay? But even people who may get the flu, even after they've had the vaccine, the symptoms aren't nearly as severe. So we highly recommend that people get the flu vaccine. And also, if you get it, then you are less likely to pass it on to someone else as well. So you're doing your bit for public health along the way, in addition to taking care of your health. And we do have typically a handful of cases of tuberculosis in a year. That's not completely uncommon, but we also need to recognize that, you know, the world is so easily accessible anymore, and people travel around the world much more now than they ever have before. And there are countries elsewhere where the incidence of tuberculosis is still quite high. So when those individuals travel, then it increases the likelihood of the tuberculosis to be spread. And that is what we are seeing at times, is that the source of the tuberculosis in many cases actually comes from someone that's come to our area from another country.
I see. So you're able to do that kind of historical check on TB cases and like what they have, where they may have acquired the disease.
Correct.
Okay.
And just like we do an investigation for a foodborne illness, okay, and everyone has heard the stories, you know, I ate at this place or whatever and I really got sick. Well, that may or may not have been caused by that food, but when we begin to do an investigation, then we try to trace things backward and try to create a story. And then once we create that story, then we can sometimes find the source and then deal with that source. It's the same with tuberculosis. And this past summer, when we dealt with the nail salon, we needed to do the very same thing. And oftentimes you start with where the people live and how many people live with them, and then you want to make sure that you test them as well. And then the second place you might go is where they work, because you could have transmission there as well. And with regard to the nail spa, what we ended up doing then is really just reaching out to the community, and the media really helped us getting the word out, because we could not track the customers down. But the media pretty much put the word out that if you patronize this nail salon, then you should get tested. And we held clinics down at the Rival building, and then we also held clinics actually down at Miami Township offices, so we actually took it right down to close to where the store was. So unfortunately, we didn't have that many additional cases.
That's good.
And we were able to deal with the ones that we actually found. So that's kind of like a case of old public health at work,
Right.
with the communicable diseases.
Right.
And we still do traditional public health, and we always will. We're not going to forget it, but we do have these other areas that we need to get involved with now.
Right, right. As things change and people's patterns change, absolutely. Let's switch the topic a little bit now to touch on the home health that's provided by Public Health Dayton and Montgomery County, because home health seems to have exploded in our community, and there are many, many providers. Seems we see a big increase in that, and yet your agency was one of the very first? Tell us about your history with home health.
We were the first game in town, and many, many years ago, we were the only home care agency really in this area. But as things evolved over time, more and more entities began to get involved with home care, and as our funding at the same time was shrinking, then we were looking at ways to change as an organization. And how can we change? We always want to know, how can we change to still provide, that our community still gets the services? We don't have to provide the services, but that the services still get provided. We're as fair as we can be to our employees, and we're dealing with our financial situation. So since we were in a new point in time where instead of being the only home care agency, we in Montgomery County, at least at the time, about 3 or 4 years ago, there were 75 different agencies, not one. It really didn't make sense for us to continue dealing with most of the patients that we were seeing. If they were on Medicaid, for example, or Medicare, there were other agencies to deal with those individuals. So what we did is we really downsized our program, but we wanted to make sure that those that were underserved or uninsured still had home care services. So we have shrunk, but we're providing services to a group that is really in need. And I believe last year we served about 175 people, doing things such as womb care and providing some really necessary services right in the home. We also have a part of our home care problem where we actually see youngsters ages up to age 3 for physical therapy, where these individuals also are not in a position to really get services elsewhere. And we're fortunate that we have a physical therapist who is specialized in dealing with young children, and she will actually go into home for those services as well. That's not necessarily a traditional public health service, but it's something that's really needed in our community, and this is a case where we had an individual to do that. So even though it's really not part of our mission as a public health agency, it's something that we do for the community because it's needed.
Okay, very good. So the numbers that you are serving, if they're uninsured or have no other access, those people receiving home health care are some of our most vulnerable people in need of that service. So glad to know that's still going on. You also, your agency also plays a really big role in helping individuals overcome drug and alcohol addiction. That's another major health problem in our community. What would you like to, that's all provided through your Center for Alcohol and Drug Treatment Services. Talk a little bit about that epidemic in our community and what our public health response is to that.
Well, clearly you could do an entire show,
Yes.
on this topic. You can't pick up the paper, any day without seeing a story with regard to, it's pretty much addiction now. But, you know, in Montgomery County, you know, there is a network of providers, and the Adamus system that I know you've had on your show, the Alcohol, Drug Addiction, Mental Health Services Board, is the coordinator of these services. And there's about 30 different providers. We are one of those 30. And our Center for Alcohol and Drug Addiction Services, or CADIS as it's referred to, which is located at Elizabeth Place, is mostly based on abstinence, okay? So these different providers have different little niches of treatment and what they do. And for the most part, not exclusively, then we deal with abstinence. So if you're addicted to either alcohol or really any other drug, then we may be an organization that can provide service to you. And we operate on a sliding fee scale, and if you can't pay, that will not be an obstacle for us. The way to get to our services is that if you are on Medicaid, then you can actually come directly to CADIS. And I'll give a phone number for all of our services in just a second. But you can come directly to CADIS for services. However, if you are not on Medicaid, then you have to go through an entity called Crisis Care, which is the navigator. What they do is they will do a diagnosis on the individual and then direct the individual in a certain way. So with Crisis Care, I believe there may be about a 2-week lag time from the time that you would walk into Crisis Care to when you would begin receiving services at any location. I believe if you would come to CADIS, you know, if you were one of those Medicaid recipients and you would come to CADIS, I don't think that there would be a wait right now. Our services are all, you know, during the day, they're outpatient type services. We do not have residential. We also are working on a small pilot project right now with what is called medically assisted therapy, okay, in dealing with opiate addiction. And the medicine that's used is called Suboxone, which would help individuals who are on either certain prescription painkillers or heroin. You know, we've seen a big change, not only in our community, but it's happening everywhere. And that is that in recent years, we've had a real increase in the individuals who have died from unintentional drug overdose. And the drugs that were the main factor in those deaths were these pain-killing drugs that had been prescribed either for the individual or for someone else and got in the hands of these individuals. And at the state level, there was various initiatives that took place to try to limit, you know, the prescription of these painkillers because they were getting in the wrong hands and people were misusing them and they were dying. So once they began to limit the distribution of the painkillers, then individuals almost immediately switched to heroin. And heroin is proven to be even more deadly than the painkillers. For example, in Montgomery County in 2012, we had set a record of 162 deaths in Montgomery County. The 2 previous years, we were about 130 deaths. In 2013, when the numbers come out, they have not been finalized yet. We will go from that 162 in 2012 to 2013. We will probably be between 200 and 250. So we are going in the wrong direction.
Clearly.
And when you take a look at the leading causes of death in Montgomery County, that would now probably be somewhere between the 5th and the 7th leading cause of death now, would be from what now is mainly heroin.
It's heroin overdose, I see. And for those who have Medicaid, though, they can go directly to CADIS
Correct.
and receive services.
Correct.
And for people who are not receiving Medicaid, the entry for help there is through Crisis Care.
Correct.
Okay. Why don't you give us a number now in case somebody who's watching has a loved one or they themselves need to visit CADIS with Medicaid.
Yeah, I would be happy to do that. And we have so many different programs at Public Health with so many phone numbers. I don't want to, number one, I don't have them all memorized. And number two, I think it'd be very confusing to your viewers. So we have one central number that I will give And you can call, with regard to any of our programs, you can call 225-5700 or 225-5700. That's our information referral line, and then they can navigate you to the right program to suit your needs.
Right, right. And so public health then, with this increase in this problem, I'm sure you're joining forces with others in the community to try to ascertain what actions can be taken to help stop this.
There are a couple different coalitions now in our community to hopefully find the solutions to this problem for us.
Right.
It is very, very difficult, and it's not just, we're not
alone
remiss in this at all. You know, everywhere there's the same problem. And people are not only just using this drug, but they're also mixing it with other drugs. And it makes for a really especially deadly mixture, and sometimes people don't even realize it. And so I really wish I had answers. I do not have those answers, and I don't know who does right now, but I do know that there's a lot of people who are going to continue to try to find those answers. Some of this, you know, may come by way of law enforcement in trying to, you know, stop the flow of these drugs coming into our area. The medical community is also involved. There's those of us who are involved with different agencies. But it is truly a problem. And it's actually more of a problem in some areas of Montgomery County than others, but it is everywhere.
Yes.
And it's not just a certain race, it's not just a certain age, it's not just, you know, a certain socioeconomic class. It really crosses all of those boundaries. And in fact, for most of the last 3 years, it's really the middle class really that most of the unintentional drug deaths really has fallen to the middle age of between about 35 and 50 years old.
And all very, very sad. Okay, on to a little bit different topic,
Okay.
but still one of a serious illness. I know that you have promoted a lot of programs to help reduce the incidence of diabetes in our community. And I'd like to hear some of the options so that people can understand what your department is offering. So,
what I'd like to do, if I might, is
Sure.
just again try to frame this with regard to chronic diseases.
sure.
As I started the program, you know, there's the communicable diseases,
Right.
but now people in our community are dying of chronic diseases. And when you take a look at the leading causes of death in Montgomery County, there are two that really stand out. And I don't think they're a big surprise to people. They're cancer and heart disease. They by far are the leading causes of death in Montgomery County. And in fact, we lose probably a little over 1,000 people a year to each of those two diseases. The third category are accidents of all types. And unintentional drug overdose deaths falls into that third category. And we probably lose about 300 or so people there. So keep in mind that 200 figure I just said. So that's 200 of the 300 all in that accident category. That category is probably growing, unfortunately. Next is respiratory diseases, then stroke, then Alzheimer's, and then diabetes. So across that full spectrum there, all of those are mostly caused by what we do on a daily basis. So it's your lifestyle that really impacts all of those. Alzheimer's would be the only outlier, and even now they know that there's a connection between your lifestyle and also Alzheimer's as well. So diabetes fell down to number 7 there. And type 2 diabetes, which is what most diabetics are, is 91% preventable by your lifestyle. So we're talking about nutrition, we're talking about exercise. The sad thing in our community is that when we did our community health assessment that we released in March of 2011, we had about 13% of our adult population were diabetic. And we wouldn't expect to make big strides there, but when our next report comes out, which will be the end of this year, it will probably show 13% again. So it's the same. We haven't done any better. I guess you could say we haven't done any worse. But you know, we do have programs specifically for diabetes. There is a coalition, you know, for diabetes as well. We co-chair that. We try to reach out in as many ways as we can. For individuals, we actually at Public Health have a prevention program for those who are not yet diagnosed as diabetic, but it looks like they're on their way. And then there's also management programs out there as well. At times, we even work with faith-based institutions to try to help, and we do see more and more of an interest of all kinds of partners, you know, including faith-based institutions, in trying to help people, you know, with the various health issues. So we'll continue to try to help people live healthier lifestyles, and as we get successful there, it's not only diabetes we're helping, but we're helping, you know, respiratory disease and stroke and cancer and heart disease as well. And you know, tobacco is one that, at least for us right now, is really on our radar screen. And that, you know, still, even knowing what we know today, Diane, that about 1 in 5 deaths in Montgomery County can be traced back, you know, to tobacco use or tobacco exposure. And but I think things are starting to turn around.
I was going to comment that there is much less smoking now in many areas. Now, maybe that's not all across the board, but one would hope that that would be moving in the right direction with all of the non-smoking everywhere, and also the cost of the product, I
Sure.
would think. But so you hope it is moving in the right direction.
Well, yeah, and I see a lot of things happening. I know our organization, the Board of Health, just in December passed a progressive tobacco, nicotine and tobacco policy for our organization. And, you know, not only do we want, you know, healthier employees, and we probably have fewer smoking employees than most organizations just because of the nature of our business, but still, you know, we want those individuals to be healthier, and we want to have a healthier workforce. And also with regard to saving taxpayers money. A recent study by Ohio State researchers show that a smoker will cost an employer $6,000 more than a non-smoker. So since our money you know, comes from taxpayers, we think that we owe that to the taxpayers to try to minimize those costs as well. And then lastly is we need to take the lead. We need to be the role model in doing these things. And while the private sector has had tobacco and smoking policies in place, at least many have for some time, the public sector actually lags behind. And we wanted to jump out and try to lead the way, and I'm happy to report that what I'm hearing is that other entities, not only governmental but schools as well, they're beginning to consider tobacco policies as well. And just this past week, I think that we saw something from a corporate giant that I know really caught my eye. In fact, it did so much that I sat down and wrote the CEO a letter thanking him for what he did, and that's CVS. CVS, part of their stated purpose is to help people on their paths to become healthier. And you know, you walk into a CVS and it's all about pharmacy and various products in their store to help people get healthier, and then you find cigarettes. Yeah. And they have stated that as of October of this year, they will be removing tobacco products from their shelves. It's going to cost them $2 billion with a B. I happen to think that they'll probably recoup that money over time. But that is a significant step to have a corporate giant in our country say, we're going to forego that $2 billion in order to be true to our mission. And what I really hope is that going forward, other leaders will take a look at what CVS has just done and say, you know, if they can do that sort of thing, then we can do it too. Right. I'm starting to see it on a smaller scale here in Montgomery County. But if we can have things done, you know, here locally and then also have people on a national scale do it, I think we'll begin to really reduce those leading causes of death that are now caused by what people do each and every day. Right.
Well, that's a very good point. So thank you, and thank you for telling us that story about CVS. Let's now turn our attention for a few minutes, although this probably could be a whole program too. I mean, public health has such a major role in all emergency preparedness. And again, that's like public health. It's just huge. It encompasses so many things. But you all are not the first responders, but yet right. You're the first responders in some of those health issues. So talk a little bit about how our community through your agency is prepared for what most of us don't ever want to think about.
Well, a lot of what we do, we try to do through what we call a public health system. And that is, even though that we're one of the largest health departments in Ohio, we can't do it by ourselves. We really can't. And I think there's no program that really, typifies what I'm saying with regard to a public health system than emergency preparedness. And because it's all about partnerships and being able to work together. This is actually a program that we do not just in Montgomery County. We have a couple programs that we do in Montgomery County and other counties. Emergency preparedness is one that we actually coordinate outside of the Montgomery County boundaries. And when you think about it, that makes a lot of sense, because if you have an incident of some sort, it's not going to just stop at the Montgomery County border and say, I'm going to stop here, and we're not going to go into Greene County.
Right.
So
we have another caller on the line, so I'm going to ask you to stop and hold that thought. We're going to come back to it after we get the caller's question. All right, you're on the air.
Hello?
Yes, you're on the air. Please go ahead.
Yes. I just have to say I'm amazed at the scope of the work being done by this Office of Public Health, and the importance of the issues, the heroin epidemic, and the work with diabetes. And I guess my question is, are efforts being made to educate and to publicize these problems so that the level of public awareness is raised higher? Because it just seems to me this is so important for our community.
Okay, well, we will ask him to speak on that. Thank you for your question. Publicity.
we totally agree with the caller in that education oftentimes is really the first step we need to take. Let's just take, for example, the opiate addiction and the unintentional drug deaths that we were dealing with. We actually received a grant from the Ohio Department of Health to do work in this area. We were one of only 2 health departments in the state of Ohio that were selected to do this.
Congratulations.
Thank you very much. And one of the things that we did last year is we actually had posters. And we actually did posters and made them kind of edgy. We actually took a picture down at the coroner's office it was actually one of our employees laying on a table with a toe tag, on, just to get people's attention. This is an issue that I don't think deserves to soft shoe. I think you really have to be straightforward, and it's probably the edgiest thing we've ever done in public health. But the poster educated people on the signs and what to do and what not to do, and those posters went up in targeted places throughout Montgomery County. There are certain areas of our city where these drug overdose deaths are at a higher rate than others, and we went in and we had a lot of agreement and cooperation of store vendors and bars that would let us put these posters up, and RTA actually let us put the posters up in their buses as well. But you can never do enough of that education. You have to educate, but you also have to take action. And we realize that now that we have to move in the direction of policies and system changes, and even in some areas some built environment changes if we're going to make a difference. And the tobacco policy that I just mentioned with regard to our organization, that's a policy change. One of the good things about our policy is that we are offering tobacco cessation to our employees right in our own office, because we do tobacco cessation and they can actually do it on their work time. Those classes, keep in mind our policy just really went into effect in January. Our tobacco cessation policies, started last week. We estimate 25% of our smokers attended that first tobacco cessation. So that's a policy change that we believe will have impact. But you do need to start with education, especially when you have a new issue in the community. And the opiate addiction problem is somewhat new, and the drug overdose problem that we have and is growing is something that we need to continue to educate on. But it is in the media nearly every day now, but we need to do more and more at the local level as well. So I agree with the caller 100%.
All right, well, thank you for answering his question. Now let's return back to emergency preparedness and how that doesn't just stay within our county lines, that something that happens is generally going to impact a larger geographical area, therefore we collaborate. So.
Back in 2002 was when we really started with our emergency preparedness plans. And we really need to take a look at 3 areas. The 3 areas are natural disasters and accidents and then terrorism. And we're fortunate that we haven't had to deal with the terrorism issue. And accidents largely are really the big players there are the first responders. So if we would have a spill from a rail car, public health would probably be involved, to some extent, but our hazmat personnel would probably play a bigger role there. Natural disasters, we're right in the middle of that one. And we had the big windstorm that we had. We did a lot of coordination with our community partners with regard to the windstorm. And really, the flu problem that we had in 2009 was another natural, we would call a natural incident. And again, we immunized about 112,000 people back in 2009, and we just didn't do it ourselves. Again, it's that coordination with all the community partners, where all the schools let us come in to do that, and their school nurses helped, and sometimes parents who had nursing skills would also come in. But we draw up plans. Of course, every incident is very different. They're never the same. And
the nature of an emergency, yes.
That's by definition, I believe. Yeah. And then we run exercises on those plans. So we practice. So we bring all the partners together. Actually, our office comes up with a scenario, and the community partners have to work through the scenario. And every single time, we get it wrong, okay? We do a decent job, but we never get it right. But that's why you practice. It's like a team. A team, never gets it right, especially, the first time. So when I say we get it wrong, I'm being harsh on all of the players. They're probably yelling at me right now, but we do things very well. We can always do them better. When you do them better, you may be saving lives. So that's why we need to continue to draw up our plans. We need to continue to run the exercises. And then the big part is evaluating how you did in that exercise. And then saying, okay, these are the things that we could do differently to make it better. And most often it comes down to communication. How do you communicate with all these different partners? Because you may have 30 or 40 people at the table to work with, especially when you're dealing with an incident, over a vast area. The last incident that we worked on through an exercise was a radiological event that actually happened in Indiana with the wind blowing, towards Dayton. And so we had to try to communicate and coordinate with all the partners in that really vast area. And when you think about, you're not just talking about police and fire, you're talking about all the hospitals, you're talking about nursing homes. It's pretty much endless on who gets involved with any sort of incident that emergency preparedness comes into play.
Well, thank you for letting us know that those plans are going on. I'm not sure the public always appreciates how much energy goes into this and how much practice. They don't see it. We don't see it, so we don't know.
A really good part about, I don't know if it's a good part, it's just the way it is with public health, is that if everything's quiet, then everything's going really smoothly. And everybody takes us for granted, and they don't even know that we're actually working. If we are doing everything to protect the food, for example, then you don't hear about any food outbreaks. And that's great. But also, I just want everyone to know that when something does happen, oftentimes we're the one who gets the call.
Yes, of course. Well, you mentioned food, and that's another very large topic in thinking about this questioning and the program tonight. I actually went on your website and looked up the inspections of a couple of places that my family enjoys eating, and I was very pleased, I have to say. But why don't you talk a little bit about your role, because it is very extensive. I don't know how many restaurants.
There's thousands.
I don't know how many kitchens we have that have to be tested, and what your staff do, what they look for when they go out to do this, and how their inspections must be surprise inspections, and then how people can do what I did and go on a website and take a look at it and see what's there. It's great information.
Let's first talk about all the different types of places that we go to protect the food. The one that first comes to mind are all the restaurants, and there are thousands of restaurants in Montgomery County that we go to every year. Okay, so we do inspect those restaurants every year, and the inspections are unannounced, so we don't tell them that we're coming. But there's a lot of food service establishments in addition to those restaurants. You know, there are grocery stores, for example, that we play a role with grocery stores. Festivals. Summertime and fall is very busy for our environmental health department in that we have a lot of festivals in this town, and we inspect every food service booth at every restaurant, you know, or at every festival, I should say. So, you know, keep in mind that's usually somewhere from early Saturday till Sunday night that our folks are actually out there doing that. And now we have a new type of food establishment in town, and these are the mobile sources. So all of them now, the mobile food trucks, also they need a license, and we inspect those as well. And we actually do go out at times at 1 or 2 o'clock in the morning to inspect some of these mobile food establishments. Sometimes we actually have a policeman that goes with us to these establishments because it's an exciting time to be out there on the streets. Yes. With everyone at that hour. But when you think about food, you need to think about how the food's stored, you know, how it is handled, how it's prepared, how it's served. And you also need to be aware of what the temperatures are, because, you know, hot foods need to be hot at certain temperatures for a certain period of time. Cold foods need to be cold for a certain period of time. You have all the utensils, you know, that need to be clean. They need to be sanitized. You have the other structures within a facility that also need to be clean. So we check all of that. And one of our most popular services with regard to food safety is our website. You know, it used to be that when people had a question about their restaurant, is it clean or is it dirty, they would either call or show up. And, you know, we would then take the time, pull out the files, and answer their questions. And we knew that we needed to be more efficient and provide a better service. So we now do all of that online. You can go to our website, that's phdmc.org, phdmc.org, Public Health Dayton, Montgomery County, and you can actually go in the search box and just write in inspections. And what we do is that we put our actual inspection report on our webpage. We don't want to try to summarize it for you. We want to give you all the inspection reports. We think that's important because we can go in almost any restaurant and find something, okay? But the key is, you know, what's the severity of the issue that we find? And then the other is how quickly did they fix it? And, you know, each year we may close down 18 to 20 restaurants usually, you know, but usually it's over a very short period of time. Usually has something to do with water not running. Maybe they have a sewage backup, they have a plumbing issue. Not often.
Rather dramatic.
Yeah, nothing, you know, it doesn't happen very often, but, you know, electric, a restaurant's going to try to operate, you know, without electric. That's probably not a good combination. Mm-hmm. So when we go, they're usually very cooperative. They'll fix it, and they'll be on their way. So, you know, we don't like to close anybody down. That's not what our purpose is. Our purpose is to educate, protect our citizens, provide a high level of food safety. That's what we want. We don't want anyone to be out of business. We really don't. That's not our goal at all.
You're inspecting to protect the health. Let's also then talk a little bit about your responsibilities for the air that we breathe. Again, here comes public health and what travels in our air and what we're living with and breathing.
This is another program that really spans 6 counties, not just one county. So we're in Preble and Dark County, Montgomery, Miami, and Clark and Greene. Again, air pollution doesn't necessarily respect any boundaries. Right. So in our program really entails at least 3 large programs. One would be the permitting of industrial sources. So any industrial source that may emit any sort of air pollutant, then we are actually the entity that actually reviews, you know, what that source of pollution is, what requirements, you know, pertain to those sources, and then our enforcement group makes sure that those things happen. You know, our enforcement group years ago were probably a lot more active than it is today. A lot of the air polluting sources are no longer in Montgomery County. Most of the pollution now comes from either power plants or your automobile. But then the third big program that we implement is the air monitoring. So we want to know what the air quality is that all of our, 500,000 people, not only 500,000 people who live here, but those who travel here are breathing. So we have an air monitoring system that monitors various pollutants in those counties. And then actually our attainment status, or whether or not our area is designated as clean or dirty, then is dependent upon those air quality results. And there could be some differences in the air quality, from monitor to monitor, but for the most part, the two pollutants we're the most concerned about are very small particles. It's called particulate matter of 2.5. So these are the small particles that get deep into your lungs. The other is ozone, that I think everybody has heard about, that really is caused mostly by automobiles and power plants. But our air quality is getting cleaner, both from ozone and particulate matter, and it's mostly due to the controls on the automobile and power plants, where entities and usually through federal legislation with regard to cars and power plants, they have to meet tighter requirements. It's offset a little bit that we drive our cars more. So we're driving cleaner cars, we just drive them more often. But overall, the air quality is improving, which is another success story of, if you want to say it's the Environmental Protection Agency group or public health, I don't think anybody really cares. It's just that we are headed in the right direction with regard to those two pollutants.
On that indicator, that's really, really good. And then I think our time is getting kind of close here, so I want to hit a couple of the topics. The other, with air, the water, okay, our drinking water, vital that it's pure and that it's clean. So what is your agency's role with respect to the drinking water?
There's a lot of people who get involved, with regard to drinking water, including, those municipalities that provide drinking water. They need to meet certain requirements. Our responsibility really falls into two areas. One is the private drinking water supply. So if you have a well, if you are going to change that well or replace it and bring in a new well, then you need to have a permit to do that, and you have to meet certain requirements. So we would do that. As you can imagine, most of the people in Montgomery County, they're on public water, they're not on private wells, but we do have a lot of people still on private wells. So we're involved there with the private well systems, and also we enforce the groundwater protection program. You're right, our underground water supply is precious to us, so we need to do everything we can to make it clean, but right now we're sitting right on top of it. And there's various ways that it can get polluted. So there is a wellfield protection program. Public health, since we go across all jurisdictions, is involved with really enforcing the groundwater protection rules that applies to entities. There's certain things they have to do if they're going to store certain chemicals, for example, and if they're going to use those chemicals. Then there's certain requirements they have to meet. So we are the ones who actually do that sort of inspection as well. Okay,
and taking care of that. So that, about how many of those inspections, go on monthly, annually, whatever kind
there are a lot of I don't have any numbers right off the top of my head,
okay.
Diane.
Yeah.
But there are a lot of entities that sit on our well field.
Okay.
And it is a big job, and again, we go across different jurisdictions to do that.
It's a lot.
So it's a lot to do. Yeah.
Right, exactly. And then finally, before we run out of time, we also the stuff that goes in the landfills. Everything that touches our environment is in your department.
Well, at least we get to do some things outside, right?
Yes, you do.
And again, we're the licensing authority with regard to landfills.
Right.
So. We will make sure that the landfill are meeting certain requirements. Oftentimes they can only accept certain types of trash. So, and there's a reason for that. If they can't accept certain types of trash, it's probably because the facility should not be accepting those, which means it may be able to get into the groundwater. They just can't handle it properly. So we do inspections of those landfills, and then we also are the permitting authority. So we actually get permits as well. As you can imagine, at times we do get complaints on those, and it could be odors, it could be crows, it could be all kinds of things. Right. So we respond to those as well. But overall, I do want to say, whether it's a restaurant or our landfills or whatever, we do have a community that cooperates with us. Usually we don't have to come down with a very heavy hand.
That's good.
but we do keep a close eye on them, so we visit them frequently.
That's a good thing. Thank you. Our time is rapidly going now, but I did want to get one last question in and give you a chance for anything I didn't ask you. Does public health accept volunteers?
The volunteers that we accept for the most part is in what's called our Medical Reserve Corps,
Okay.
with regard to emergency preparedness.
Yes.
As you can imagine, when we do have an incident, then we need help.
Right.
And if they call the 225-5700 number and want to help us in an emergency, please give that number a call, and then we will get you connected with the appropriate person to get you on the list. And then when an incident calls, we'll give you a call, and hopefully you can help us. But
That's
what we
great.
find sometimes is that when an incident is happening, they have something that
They're
to
already-
do with their own family or
I
with
see.
their own job.
I see.
So we need a lot of
Well, thank you
helpers.
very much
You're
for
welcome.
coming and providing all of this information to the viewers. I know that people have learned something, because I certainly did tonight. Are there any closing remark you'd like to leave for our viewers before we're completely out of time?
We have a lot of other programs we do, but I
Yes.
guess we can't talk about them tonight.
Well, we'll just have to have you come back to do that again.
I'll be happy to
Thank
do
you.
that.
Thank you very much, and thanks to the viewers for watching. Good night.